Welcome to my channel. This is Dr. Rashid. Today we will discuss about painful urination. Our body has a natural mechanism of flushing out toxins, waste product and harmful substances through stools, urine and sweat. The urinary tract of our body is among one of these systems, which involves a combination of organs that filters the blood and flush the waste out in the form of urine through the urethra. Any pain or discomfort that is felt while passing urine is known as painful urination. The common causes include infections of the urinary tract or other pelvic organs, swelling, dehydration, kidney stone, tumors, etc. The most common symptoms is a pain while passing or initiating urination. However, it may also be accomplished by some other symptoms such as foul odor, discharge from the urethra, redness or irritation in the pelvic region and more. Pain while urinating can be prevented by eating a healthy diet, drinking enough liquids, maintaining personal hygiene, limiting alcohol and smoking, and getting a regular medical checkup at least once a year. The treatment includes medication to resolve the infection, swelling, and small kidney stones, and surgery to remove tumors and bigger kidney stones. Prognosis is usually good when the treatment is employed in time. Complications are rare and may include recurrent infections, blood infections or sepsis, kidney damage, premature delivery or low birth weight, and more. What are the symptoms of painful urination? Urination may present with various associated symptoms. The first one is pain. The symptoms of painful urination are mostly seen while passing urine. Anyone may experience pain while initiating or for the entire duration of urination. The pain is mostly sharp, unpleasant, and discomforting. Pain may or may not persist after urination. Pain may or may not persist after urination. Fever. When urinary tract is infected, someone may often experience a rise in body temperature. Fever may be of mild to moderate degree, above 38.5 degrees Celsius. Fever may also be associated with chills, cloudy or bloody urine, along with pain. Someone may notice a change in his urine color. Urine may not be clear, pale yellow anymore and may show cloudiness or a tingle of redness because of blood as you urinate. Abnormal discharge of pus, blood or any other fluid. Sometimes you may also notice fluid, blood or pus discharge during or after urination. Your urine may also have a pungent and unpleasant smell. Frequency of urination. In some cases, painful urination is also associated with an increased frequency of urination and also an increase in urge to urinate. Flank pain. Flank pain is the pain or discomfort which occurs between the ribs and the pelvic area, near the iliac bone, a part of the hip bone which is present on either side. Rashes, itching, and burning. Painful urination, which is associated with an underlying infection, often has rashes, redness, and burning sensation because the person experiences itchiness in the pelvic area and hence scratches it in order to get some relief. Blisters or sores. Blisters and sores are usually seen in painful urination caused by sexually transmitted disease or STD. These blisters are present in the pelvic area, around the vagina, and on the penis. What are the causes and risk factors of painful urination? Causes of painful urination. The number one is infection. Infection in the pelvic area is the most common cause of painful urination. Since the urinary and the reproductive organs are closely placed in both men and women, the infection of either of the two will result in a painful and uncomfortable urination. Infection of the urinary system. Our urinary system is a system of organs which are connected together and with the rest of our body through blood. It is especially involved in removing our body waste through urine. The organ of the urinary system include the kidney, ureters, urinary bladder, and urethra. If anyone experiencing discomfort while passing urine, the infection can be present at any level of the urinary system. Someone may have infection in the kidneys or of the part involved or collectively cause. You may have an infection in the kidneys or ureters or urinary bladders or urethra. The infection of the urinary system, irrespective of the part involved, are collectively called as urinary tract infections or UTIs. In females, the length of the urethra is shorter and hence the infection can travel up easily through the urethra to other parts of the urinary system. You can get an infection of the urinary system on using a contaminated toilet, touching the pelvic area with infected hands, and sometimes it can also be bloodborne, an infection which is already in the blood and reaches the urinary system. Infections of the reproductive system. In both females and male bodies, the reproductive and the urinary system are present adjacent to each other. In males, there is a common tube for urinary as well as reproductive secretions which lies in the penis. In females, the opening for urethra lies close to the opening of vaginal secretions. Hence, any infection in your reproductive system may cause pain while urinating. You may contract sexually transmitted infections from your sexual partners who have herpes, gonorrhea, or chlamydia infections in females. Fungal infections in the vagina are common and painful. These infections cause changes in the affected skin, which, when comes in contact with the passing urine, causes severe pain. The infection of the female reproductive organ is collectively known as pelvic inflammatory disease or PID. Inflammation. Inflammation in your pelvic area is another common reason that you are experiencing painful urination. As we have already explained, an inflammation in either of the urinary system or the reproductive system can cause discomfort while you urinate. The inflammation can occur at any level in the urinary or the reproductive system. For example, nephritis, pyelonephritis, urethritis, vaginitis, cervicitis, etc. The treatment of painful urination. Diet, medications, these are important for the treatment. If you are not treating your body with enough fluids, you are certainly setting it up to catch infections easily. Dehydration causes irritation of your urethra and increases the concentration of your urine. Both of them may cause pain while urination, along with a high chance of contracting UTIs. If you are filling your tummy with alcohol, coffee, tea, too much sugar, acidic and spicy food, carbonated drinks, etc., then you are most likely causing irritation to your urinary bladder. Your urinary bladder thus responds with pain whenever you go to urinate. Some medication used in chemotherapy such as cyclophosphamide, diclofenic acid and other non-steroidal anti-inflammatory drugs, allopurinol, etc., cause inflammation of the urinary bladder and may also cause urinary incontinence. Today we'll discuss it. This is the first part. In another part, we will discuss the rest of the topics which is covering this painful urination. Thank you all.